The study, published in the prestigious British medical journal The Lancet, was based on research from several dozen countries around the world. It found that inactivity now kills 5 million people a year, as many as those who die from smoking.
That's a big problem. We've known that the body is made for movement, and so when people tend to be inactive, bad things happen in the body. It can lead to health problems like diabetes, heart disease, and other health problems. And one of the conclusions that they came up with is that nearly 10% of all deaths worldwide may be caused by physical inactivity. So that's quite striking.
Not surprisingly, the problem is particularly acute in the rich countries, where most people have cars and no longer do any hard physical labor. With smoking rates down sharply in most rich countries, a lack of physical activity has taken on an ever greater importance.
The human body is made for movement. Our lungs work better, our heart works better and such when we move. Our metabolism is improved when we move and such. And so when we're inactive, a number of things happen. Our metabolism slows down. We tend to burn off some muscle and some bone, believe it or not. Our cholesterol levels go up. There's a number of these metabolic derangements that occur, which leads to these chronic diseases.
The study's authors say more needs to be done to get people moving.
What the report says is that we need to have essentially both a bottom-up and a top-down approach. On the one hand, we need to educate people about the importance of being active and about how they can be active in their lives. On the other hand, from a public health level, from a top-down approach, we need to make it a little bit easier for people to be able to be active, even in this environment with lots of technology and labor-saving devices. So supportive environments that we could nurture are things like making sure that streets are safe for people to go out for walks on, making sure that there's availability of community parks and things so that people could go out and play soccer and such. Things like that, policies, communities and such that help people have the opportunity to be active.
Here in the United States, attitudes towards exercise have been clearly changing in recent years.
Most definitely, more people come to our gyms now. The level of people knowing more about Zumba and cardio kickboxing and also the different classes that you can work on stretching your body and strengthening your body. You see a lot more people coming to the gym, getting more notifications through their doctors, through other medical assistance that they're looking to get from to live longer and to live better.
Public health doctors are increasingly focusing not just on obesity, but also on the need for people to become more physically active, whether through exercise or simply walking. Until 1 or 2 generations ago, nearly everyone walked and did some form of physical labor. Now machines do the hard work, saving us from the drudgery but making us less healthy. Public health authorities are now increasingly insistent that more must be done to make sports and exercise safe, easy, and a normal part of everyone's life. Burton Bolak, KSA2, Washington.